Hey everyone, welcome. Dr. Mike here, ready to dive into a critical topic. Today let's break down, in simple terms, what a heart attack really is. We'll explore the mechanics behind it. You might picture someone clutching their chest in severe pain, but it's much more complex than that single image. It's a cascade of events. A heart attack, also known as or myocardial infarction, which is the medical term, happens when blood flow to a part of the heart muscle is severely reduced or completely blocked. This blockage prevents oxygen from reaching the heart tissue. The heart, like any other muscle, needs a constant supply of oxygen-rich blood to function properly, delivered by a network of vessels called coronary arteries. These arteries are vital for heart health. When one of these crucial arteries gets blocked, usually by a blood clot, the heart muscle, deprived of oxygen, starts to die. This is a serious and time-sensitive situation. Think of it like a city losing its main water supply. Imagine the chaos, parts shut down fast. The same happens with the heart. Remember, a heart attack is fundamentally a plumbing problem, a blockage in the heart's blood supply, not primarily an electrical one like cardiac arrest, which involves the heart's electrical system malfunctioning. However, the blockage caused by a heart attack can, in severe cases, lead to cardiac arrest, which is why acting fast and seeking immediate medical attention is absolutely critical. Time is muscle. Understanding this key difference between a plumbing and electrical problem could ultimately save a life. Stay informed and stay safe. So, what exactly triggers these blockages that can lead to a heart attack? What are the underlying mechanisms at play? The main culprit, in the vast majority of cases, is atherosclerosis, a gradual process of plaque buildup inside your arteries. This is a condition that develops silently over time. Over many years, cholesterol, fats, cellular waste products, and other debris circulating in your bloodstream begin to collect along the inner walls of the arteries. This accumulation gradually leads to a narrowing of the arteries, a condition known as stenosis, restricting blood flow. Lifestyle choices play a significant role in accelerating this process. A consistently poor diet, high in saturated and trans fats, a lack of regular physical exercise contributing to elevated cholesterol levels and poor circulation, smoking, which damages the lining of the arteries, making them more susceptible to plaque buildup, and uncontrolled high blood pressure, which puts extra stress on the artery walls, speed up this process considerably. This plaque can sit quietly and stably for years, often without causing any noticeable symptoms, slowly growing in size. But the real trouble begins when this seemingly stable plaque suddenly ruptures or breaks open. When a plaque cracks or fissures, exposing its inner core to the bloodstream, your body's natural healing mechanism kicks in, and it immediately forms a blood clot at the site of the rupture to try and repair the damage. Sometimes, unfortunately, that blood clot grows so large that it completely blocks the artery, obstructing the flow of blood. Suddenly, blood, and therefore vital oxygen, can no longer reach a portion of your heart muscle. This is known as ischemia, and that's precisely when a heart attack begins, triggered by this sudden lack of oxygen. The heart muscle, now starved of oxygen and struggling to function, sends out pain signals and other warning signs, alerting you to the critical situation. Next, let's delve deeper and talk about how this entire process unfolds step by step, from the initial plaque formation to the full-blown heart attack. Here's how a heart attack develops inside your body. Over time, fatty deposits and inflammation create plaque in the artery walls. The plaque grows, narrowing the artery's open space. For a while, you might not notice anything wrong. The real danger comes when the plaque's cap ruptures, often triggered by stress or high blood pressure. Platelets rush in to form a clot, but inside a narrowed artery, this is disastrous. The clot can quickly block blood flow entirely. Without oxygen, heart muscle cells start dying within minutes. This is the infarction in myocardial infarction. The longer the blockage, the more permanent the damage. That's why every second counts. Recognizing a heart attack early can save your life. The classic symptom is chest pain pressure, tightness, or squeezing in the center of the chest. But symptoms can vary, especially for women: shortness of breath, nausea, back or jaw pain, or pain in the arms. You might also feel lightheaded, break out in a cold sweat, or feel unusually tired. These are your body's alarm bells, don't ignore them. Many people wait, thinking it's just heartburn or anxiety. But with a heart attack, every minute means more heart muscle lost. If you notice these signs, call emergency services immediately. Don't drive yourself. Fast action saves lives. In medicine, particularly when dealing with the heart, we have a critical saying: time is muscle. This isn't just a catchy phrase, it's a fundamental principle that guides our actions in emergency cardiac care. Every second that passes during a heart attack can have a significant impact on the extent of damage to the heart muscle. The longer your heart muscle goes without a fresh supply of blood, which carries vital oxygen and nutrients, the more tissue dies, permanently. This is because the heart muscle cells deprived of oxygen begin to undergo necrosis, leading to irreversible damage. Emergency treatment aims to rapidly open the blocked artery, restoring blood flow as quickly as possible. This is a race against time to minimize the amount of heart muscle that is lost. We achieve this using clot-busting drugs, also known as thrombolytics, or through interventional procedures like angioplasty and the placement of stents to keep the artery open. The sooner you recognize the symptoms and get help, by calling emergency services immediately, the better your chances of a full recovery and improved long-term health outcomes. Early intervention can significantly reduce the extent of heart damage. Knowing your individual risk factors, like having high blood pressure, which puts extra strain on your heart, elevated cholesterol levels, which can lead to plaque buildup in your arteries, smoking, a major contributor to heart disease, and diabetes, can empower you to take proactive steps to prevent a heart attack from occurring in the first place. Learn to recognize the warning signs of a heart attack, such as chest pain, shortness of breath, and discomfort in the arm or jaw. Talk to your loved ones about these symptoms so they can also be aware and act quickly if needed. And don't hesitate, even for a moment, to call for help if you suspect a heart attack. There's absolutely no shame in a false alarm. Medical professionals would always prefer to err on the side of caution, but waiting, even for a short period, can cost you everything. Your heart works tirelessly for you, day in and day out. Protect it with the same dedication. Stay informed about heart health, stay alert to any potential symptoms, and make conscious choices every day to take care of your heart. Be well and prioritize your heart health for a long and fulfilling life.